I'm Dr. Vivek, the consultant vitiligo surgeon at Noble Clinic. On a day-to-day basis, we are inundated with a lot of emails asking us for various treatment options on vitiligo. Some of these are new patients and some of them have been suffering and are not been recovering to whatever treatments that they are on. We have made a list of FAQs which we feel can help you all decide whether you suffer from it in the first place, and if at all you are suffering, then what are the treatment options that you have. The most important question is, what is vitiligo and how does it happen? Vitiligo is an extremely common skin disease and it is caused by death of color manufacturing cells called melanocytes in the skin. The job of the melanocytes is to manufacture melanin, and this melanin is stored in keratinocytes in the epidermis. So when these melanocyte cells die, there is no more production of the color pigment and the skin turns white. What makes a patient seek advice? Everybody knows that it is a harmless skin condition, but the main problem with vitiligo is the psychological depression which almost all the sufferers have. They find it difficult to get married or to get jobs, and this is one of the main reasons why the psychological depression drives them to doctors to seek advice. What are the causes of vitiligo? There are three main causes why the melanocytes in the skin can die. The first is genetic, the second is autoimmunity, and the third is what is called as segmental vitiligo. Genetic accounts for about 3 out of 10 patients, and there is a very strong family history of either the parents or the grandparents suffering from white patches and passing it on to their children. Autoimmunity accounts for about 70% of vitiligo sufferers, wherein the body's immune system manufactures antibodies. These destructive antibodies destroy the melanocytes in the skin, and wherever the cells are dying, there is no manufacturing of the melanin pigment and the skin turns white. The third variety is what is called as segmental vitiligo, wherein there are certain nerve fibers in the body, and these nerve fibers are known to produce certain poisonous substances which can kill the melanocytes. And the patches in segmental vitiligos travel along these nerve fibers. They tend to be solitary, and normally in certain cases it may be a starting point for development of generalized vitiligo. What are the clinical types of vitiligo? Clinically, a white patch can be classified into segmental, focal, then you have generalized, then you have acrofacial and periorifacial. A segmental vitiligo tends to be a single patch and it's restricted to one side of the body. It doesn't cross the midline. Generalized vitiligos normally tend to occur on both sides of the body, and in acrofacial the patches appear on the hands, the feet and on the face, whereas periorifacial vitiligos develop around various openings on the body like the eyes, the ears, the mouth, around the umbilicus and sometimes around the genital openings. Now once vitiligo happens, it keeps spreading for a variable period of time and then it may stop spreading. This can take months to years in patients, and some of these patients in the time frame can totally depigment. What are the treatment options available for vitiligo? Vitiligos can be treated medically or surgically. In medical treatment, you have various systems like allopathy, homeopathy, Ayurveda, Siddha, Unani, and surgical options are available only in allopathic medicine. When we see a new patient of vitiligo, we have to wait and treat them medically. The medical options in allopathy include steroids, immunomodulators, immunosuppressives, then we have narrowband ultraviolet light, and we have excimer lasers. Once we start them on medical treatment, we continue for about 1 to 2 years and see the progress. Some of the patches respond to medical line of treatment, some of them don't respond to medical line of treatment. For patients who have stopped responding to medical line of treatment after 1 or 2 years, we have to look at surgical options. What are some of the surgical options available to us? We have the older ones like skin grafting and punch grafting, and the latest one which is autologous melanocyte cell transplant. Skin grafting and punch grafting were the older treatments that were available to us. In skin grafting, we remove a piece of skin which is of symmetrical size to the patch, and then we transplant it onto the white patches. The main problem with skin grafting is only small patches can be taken up for treatment. The cosmetic results of skin grafting may not sometimes match, with the donor skin color not matching the recipient skin color. Punch grafting is another older technique where small pieces of skin are transplanted onto the white patches. The main problem with punch grafting is what is called as a cobblestone appearance. And cobblestone appearance doesn't make it cosmetically a very suitable treatment for vitiligo. The latest treatment option that is available is what is called as a melanocyte transplant surgery, wherein we take a small piece of skin, we remove the color manufacturing cells made up of melanocytes and keratinocytes, we centrifuge it to get a suspension, keep the cells alive till we transplant it onto the white patches. The advantages of melanocyte transplant is that a small piece of donor skin yields enough cells which can cover huge areas of white patches. About 3 to 6 weeks is the time frame required for the cells to start manufacturing pigmentation, and it takes about 2 to 3 months for the pigmentation to get complete. After a period of 3 months, variable areas of patches which are treated respond, and there may be a chance that a second sitting is required to deliver results. What are the success rates of cell transplants? We have seen very good to excellent success rates in segmental vitiligo, a very decently good success rate with generalized vitiligo. However, in acrofacial vitiligo, the response to cell transplants is like an all or none phenomena. They do either very well or they do not do well at all. What are the disadvantages of surgery? The main disadvantages of any surgical treatment, may it be skin grafting, punch grafting, or even cell transplant, is that it is not a permanent cure. It helps to cure existing patches only. There is a chance that the area where the skin that is removed, that is a donor area, can turn white in color. And there is always a possibility that the development of new white patches in future cannot be ruled out. So if you are one of the vitiligo sufferers, we request you to go and approach your dermatologist. Most of the vitiligo patients can easily be treated now with a combination of medical and surgical treatment, and it is not a disease which should be mistaken for leprosy, and it is curable to a large extent in large number of people.